Welcome everybody. This is our next podcast update to give an update about how the North Brisbane Partners in Recovery project is being implemented. I have with me here today Paul Martin, who's the System Reform Lead, who works here at the Medicare Local and does a lot of support with all of our support facilitation agencies, consortia advisory group around the whole area of system reform. So our topic of today's short update is around the Innovation Fund. So the Medicare Local has some flexible funding to be able to make available to our sector and through the region to be able to improve outcomes. So Paul, would you be able to tell us a little bit about the Innovation Fund and how that fits into the work of Partners in Recovery?
Sure, thanks Pauline. I think as most people will know, Partners in Recovery is about improving the health and well-being of people with severe and persistent mental illness, and particularly those people who've got complex needs. Now, Partners in Recovery, of course, works with individuals and their carers and their support services to get them all working together to support the person, but we also work at the system level. So that means we're interested in the mental health system and the wider human services system and how that supports the recovery of people with mental illness, and how we can work at that systemic level to make change so that the system works better for individuals. And so the Innovation Fund supports projects that will help to reform the system so that it works better.
So talking about system reform, what type of projects are funded? What are we looking for within the Innovation Fund?
Well, firstly, projects need to be focused on system reform. So it's not about direct service delivery and particularly ongoing direct service delivery. It is about system reform. So that's about making changes to the way in which the service system works to support people with mental illness. It also needs to be focused on outcomes for adults with people with severe and persistent mental illness who've got complex needs. So it has to be for the benefit of the PIR target group, which is adults. It needs to be collaboration of organisations. So the partners in Recovery is there for a reason. So we do want to encourage partnerships of organisations to work together. And particularly if there are organisations or services that haven't traditionally worked together, perhaps they're from different fields, but they have some kind of a connection in the way in which they support people with mental illness. So collaborations of organisations, but they need to be led by an organisation who signs the contract with Medicare Local. Has to operate in Metro North Brisbane, because that's the area for this Partners in Recovery region, and that includes Moreton and Somerset is our region, so not just suburban Brisbane. And the types of projects that could be funded, well, it's quite varied. We're really looking at people's innovative ideas. So maybe it's training, or maybe it's partnership building, maybe it's a pilot project, a new way of doing something that's got a bit of an evaluation built into it so we can see if that works and then roll that out at a later stage. It might be research so that it informs our practice. It might be looking at how we better coordinate care, how we better integrate services. So really, it's anything about organisations working together to find new and innovative ways to support people with severe and persistent mental illness.
So there's quite a bit of scope there within the guidelines, really looking for some innovation. So we've done the first round of innovation projects, so they've just been announced. So what ones, which organisations were successful with that round, Paul?
Sure. So the first is the Multicultural Association of Caboolture. They're leading a collaboration of organisations looking at how people from culturally and linguistically diverse backgrounds in the Redcliffe Caboolture area connect with mental health services, doing a bit of a map of those communities, what their needs are, and making sure that they and the services that are there for them are connecting together. So that's the first one. Second one is the Queensland AIDS Council, previously known as Health Communities, and they're going to be delivering some LGBTI, lesbian, gay, bisexual, transgender, intersex, awareness training for PIR organisations and their referral networks. The next one is Brook Red, which is putting on a 2-day forum for consumers. So people with severe and persistent mental illness who reside on the north side of Brisbane coming together for a couple of days to look at, well, what does recovery mean from the consumer perspective?
Consumer-led stuff.
And what type of system reform projects would they like to see? We'll also be funding Connections, who are leading a consortium or collaboration of organisations looking at how different parts of the mental health system can work together and understand each other. So the clinical, the non-government, the private sectors, what do we all do? Who are we? How do we refer between each other? How do we better communicate with each other? And putting that all together in one central location, which they're calling a collaborative practice manual, which will probably be online so that can be updated over time.
Yeah.
So that question of who's out there and I don't know and how do we work together, hopefully will be solved through that project. And then we come to two of our larger projects, and the first one is the New Farm Neighbourhood Centre and the Under One Roof Consortium, and they're going to be trialling a new triage system so that people who are homeless or at risk of homeless can rock up to a wide range of services on the north side of Brisbane and receive the same standard assessment, and over time the same IT system. And referrals into support services. So kind of a no wrong door approach that you can rock up to any agency, be assessed, be easily referred to the services that you need, not have to repeat your story again because everyone's sharing the same assessment and eventually the same IT system. And then lastly, but of course importantly, is Sandbag, who is a Sandgate neighbourhood community organisation, and they're working with a number of neighbourhood centres in their area to look at what's the particular role of neighbourhood and community centres in supporting people with mental illness. Because we know that some people who perhaps aren't attached to or connected with the formal mental health system do connect with their local community organisation, and they get something a bit different from their local community organisations. So we want to really understand what that difference is and what role community centres and neighbourhood centres play in supporting people with mental illness, but also to talk to those consumers about their experiences. So there's some digital storytelling and some other initiatives that are part of that. So that's our first 6 funded projects for the first round of the Innovation Fund.
Excellent, that's great to hear. And from those examples, obviously it's people who have already been doing reform work, you know, who want to be able to take forward their good ideas even further. So if people have a great reform idea and they want to be a part of the Innovation Fund, how do they find out about it? How do they get a part of this?
Lovely.
Yeah.
Well, expressions of interest for the 2014-15 Innovation Fund are now open. So from our consultations, with consumers and carers and service providers, we've identified a number of outcome areas that we're interested in seeing being achieved. So we're specifying the outcomes that we're looking for, but what we're asking services to do and collaborations of services to tell us their innovative ways to achieve that outcome. So we're trying to move to that outcome-based funding arrangement. So we're still looking for collaborations of organisations, but those collaborations just need to submit a really simple couple of page stage 1 application form, which just gives us a brief outline of how they're going to achieve that outcome and what makes their project particularly innovative. So that stage 1 application needs to be with us by 5 p.m. on Monday the 31st of March. So you've got about 5-6 weeks to get your stage 1 applications together. Those applications will then be assessed by a panel that includes people from within the North Brisbane PIR initiative, but also some people external, so that there's a fair and transparent process there. And then a select number of applicants will be invited to make a more detailed stage 2 application. And then we expect projects to be able to start in July of 2014, and they'll have the full financial year to run, so concluding by June 2015.
Yeah, so giving a good period of time.
Absolutely.
Yeah. So how can people find out more, Paul?
Sure. So that everyone receives the same information, we do ask that people email us and request a copy of the application guidelines and the stage 1 application form. So you can email us at innovationfund@mnbml, Metro North Brisbane Medicare Local.com.au. But that email address is also available on our website, which is www.northbrisbane.pirinitiative.com.au. So you email us with a request for the application form and the guidelines, and then a reminder you need to go back to us on the 31st of March or before.
That's wonderful. Well, thank you very much, Paul, for giving us such a concise and thorough overview of the Innovation Fund. We really hope that the sector will thinking about their ideas and taking the advantage of these resources that Partners in Recovery currently has in order to be able to reform and improve the system. So thank you.